As COVID numbers continue to grow, people are scrambling to get their hands on COVID test kits before the holidays. Take a look at the lines that we're seeing. This was yesterday in West Philadelphia. The Philadelphia Health Department is giving out 2 free rapid test kits this week to residents. And demand was so high, they ran out in some locations and they had to send more. So I want to bring in Philadelphia's Health Commissioner, Dr. Cheryl Bettigole, who's joining me now. Good morning to you.
Good morning.
Well, first, I guess if we're supposed to find a positive in this, the good news is that people are trying to get tested.
Yeah, no, there is good news here. People are trying to get tested and people are getting vaccinated in numbers higher than we've seen in a while. So there is something to celebrate here.
But there is something with the lines. We don't want to deter people from getting those tests. So it looks like you guys are trying to get your hands on more. And when can we see that?
Well, so we are trying to get more. We will be giving out more tests today. We were resupplying our sites throughout the day yesterday. And, we have a very limited quantity. So it's important that people understand that. We are trying to get as many out into people's hands as we possibly can, understanding both that some people can't afford the tests and that they've also become very difficult to get. I will say that tests tell you if you have COVID. So they're great to use before you see somebody at high risk. They don't prevent you from getting COVID. So, we all need to be just thinking about all the other ways we keep ourselves and our families safe.
Let's talk about some of the positive cases that we're seeing. As on the screen right now, we do have up the different locations where you can get those free COVID testing kits. We want to make sure people see that, and we'll put that on the website. When it comes to the positive results that we're seeing, how is that going? What are the numbers looking like? And when it comes to hospitalizations, are we seeing quite an uptick?
Yeah, so both. Cases are up immensely. So we are averaging 641 cases a day. Yesterday, the 24-hour report was over 1,000 cases. So this is definitely a time we all need to be very, very cautious. Hospitalizations also up, closing in on 400. So, we're not at the stage we were last winter, but we're going right into the holidays. And I just want to stress to people, test if you can before you see somebody at risk. But remember, keep those gatherings. If you're going to get together, keep them small. Do not go to large indoor parties right now, especially, if you're going to eat and drink, which most people do at parties. That's a risky situation where you can really spread a lot of disease. And this is all around us at this point.
So do we know, because the national headline is that Omicron is the most prevalent variant right now. Do we know if that's the same situation here in Philly?
The last information I have on sequencing is that it had increased markedly. It wasn't yet the dominant variant, but it's spreading so quickly that, if it isn't today, it will be in a few days.
Okay. And this, of course, as we are still having, some large scale events, we're still having our sports and all that. Do you think, even though I know come January 3rd, there's going to be the mandate put in that you have to be vaccinated in order to be in certain scenarios and to be indoors, do you think that we may need to push that up, or do you think at the rate we're going, hey, if we just are aware, that should be enough to last us until January 3rd?
Well, the reason we chose January 3rd was to give businesses time to implement this mandate. So any business that is able and interested in implementing early, absolutely. And anybody who isn't both fully vaccinated and boosted, really think twice about any indoor event that you're thinking about going to. At least keep your mask on and make sure you're wearing either a double mask or an N95. Don't take that mask off indoors to eat or drink if you don't have full protection, because, this is just a very high risk time. You really have to protect yourself. But I would think if you're not fully vaccinated and boosted, I would think about avoiding those big indoor events.
Okay. And what about schools? Of course, we had the unfortunate news at Alney Charter High School where we know a student there did die from COVID. Is there any talks about what we're doing in schools? We know that some schools are deciding to kind of not come back immediately after this holiday and go virtual for a little bit. Do you think that there will be a mandate when it comes to schools, or are we going to leave it up to each and every district to decide on their own?
We're really trying to support the schools to stay open. Kids need to be in schools. It is so important for them. That doesn't mean schools that decide to wait a week after break are wrong. But what we're trying to do is do everything we can to support their ability to stay open, at least as much as possible. Knowing that sometimes there are schools, individual schools that have so many cases that they do have to go on pause temporarily. But if we could possibly avoid pausing the whole school system, we are going to do that.
Okay, and it's important to also reiterate, because I do know you mentioned this, even though we are seeing an uptick, and even though this is something that we should be concerned about and aware, especially as we gather, we are not seeing the same numbers that we saw this time last year, are we? Or
no, we're not. No. And I think, Philadelphia is a very highly vaccinated population. And I think that's part of what we're seeing is, we are now more than 76% of our adults are fully vaccinated. More than 96% have had one dose of vaccine. Now, that still leaves a couple of 100,000 adults who are not fully vaccinated. So we still have real risk. But I think that's the reason we're not seeing the kinds of numbers and the kinds of hospitalization numbers that we saw last winter. The vaccines work. It's just that we really need the boosters to protect us, particularly from Omicron. And we really need to reach the remaining people who aren't vaccinated, including our kids.
Okay. Once again, I want to just put up on the screen the different locations you can get those free COVID tests. Moving forward, what days, is it every day, or what days will they be available so people know when to go as we put the information on the screen?
Well, I do want to caution people, supplies are extremely limited. We're getting more tests as quickly as we can, but we have the tests scheduled to be given out through Thursday if supplies last. If they don't, as soon as we get more, we will be giving them out. I've heard a hint of positive news on the federal front. We really need the federal government's assistance here across the country to make tests more readily available for free. And there was maybe a hint that there's going to be an announcement later today on that, which is encouraging.
Okay, then we certainly will be looking out for that. And then one more, if some folks are able to purchase their own, there's been a lot of discussions as people decide, if they're going to see their family members and how to see them. Do you recommend, what's the process here? Do you do your tests the day before and then again on the way over, or do you do it just once on the way over? I mean, I've heard so many different recommendations. In your personal opinion, what do you say people should do?
Well, I think it depends on the resources they have. And remember, these rapids that we're giving away are not the only tests in Philadelphia. I went on the phila.gov/testing site this morning to make sure, and there are still testing appointments available for rapids or for PCR. So if you need a test, that is another option that's open to you. There are different kinds of rapid tests. There are professional tests that cannot be just given to people to use in their bathroom because they have to be done in a CLIA certified setting. And then there are the home tests. So you can go to a center and get a test done if you don't have one at home. But in terms of what to do before you visit someone, the official recommendation is 2 tests. So day before you're going to go and then right before you go. If you have limited tests, I would do the test right before you go. Because especially with Omicron, if you test yesterday, you could really be contagious today. It's hard to know that. So you want to test as close to the visit as possible. And, 2 is ideal, but people may not be able to afford or to get right now 2 tests.
Mm-hmm. And we should also note, if you are able to afford and able to locate one, the at-home test, usually they come 2 in a pack. And so you'll be able to use it that way. I guess you said 1 the day before and then 1 right as you're going over. Is that just because to give it a chance, just to double check to make sure that you are negative?
Yeah, it just gives more security. I do think that many people will be using the 2 in a pack for 2 different people, which, more security for more people. We're all doing our best with this. So it's not, the recommendation is 2 consecutive days, but if you don't have a choice, I would just do 1 the day of.
Okay. Well, thank you, Dr. Bettigole. We appreciate you taking the time. And of course, we'll continue to be in talks with you as we get through this holiday season.
Great. Thank you. And everybody, please keep those gatherings as small as possible. Take care.
Okay. All right. Thank you. We're going to take a break.